she left.
Okay, we are so far from that happening.
Do something, Kelly. Promise me you won't let them take my leg.
Don't promise. No.
I promise.
Hey guys, Dr. Dan here. Welcome back to my channel. If you're new to my channel, I'm a practicing orthopedic spine surgeon, a new dad, and here on YouTube, I love teaching medical concepts and also inspiring all of you future doctors out there by reviewing medical dramas. The current crowd favorite is Grey's Anatomy, and today we're doing part 3 of the aftermath from the plane crash in Grey's Anatomy, coming to you right after this. Before we get started, I just want to thank every single one of you guys for being here. You guys are always leaving such encouraging comments, and it really helps. Between operating and seeing patients in the clinic and chasing my toddler around, it's a little tough to find time to make these videos, but your comments really push me to make better and better videos, so thank you so much. I'm going to ask you for a small favor. If you can go ahead and smash that like button down below. If you're new to my channel, please hit the subscribe and the bell notification so you don't miss another future Dr. Reacts video. Let's get started.
Pretty amazing recovery, right?
Yeah, his stats are good. He's been weaned off pressors.
Yeah, BP's 110/60.
And he's making inappropriate sexual comments to Brooks.
It's fine.
No, it's not. But right now I'm really enjoying it.
So here they're assessing Mark Sloan, and Derek and Avery make 3 comments about him, which is that his sats are good, BP is 110/60, and he's weaned off of pressors. Now, 2 of these numbers that they're talking about are actually vital signs, which are used to monitor how stable a patient is. And SATs are actually referring to oxygen saturation, which is the amount of oxygen that is in someone's blood. And a good saturation is anything that's anywhere from 95% to 99%. Here on this vitals monitor, you can actually see the oxygen saturation, which is in yellow there next to the letters SpO2. BP is actually a measurement of the force of blood against the arteries, and this is actually another way of just assessing how well the blood is flowing through someone's body. And you don't want this number to be too high or too low. A normal blood pressure is measured at 120/80. 110/60 is not bad. So Avery also says that he was weaned off of pressors. Pressors refers to vasopressors, which is a class of medications that actually raise blood pressure by constricting blood vessels. So with all of these 3 things combined, it does sound that Mark Sloan is doing pretty well.
What's the surge?
In many terminally ill patients, they have a final surge of energy. They get better before they get worse.
But in a little while, he'll do what all patients do. He'll have epiphanies. He'll tell you what really matters in life, ask for his family.
So Dr. Weber talks about the surge, which refers to something called terminal lucidity, which is the sudden period of memory coming back and clarity for a patient right before the death. And it's really just been described anecdotally. It hasn't really been confirmed scientifically or studied very well. In this article, it refers to a couple instances that doctors described where one patient woke up all of a sudden and asked for their favorite hamburger. There aren't any great studies on this out there, and really more research is needed, but it definitely makes for good television like it is in this episode.
And we get to help take that worry away. It's why we're doctors. It's actually why we're people. But somehow we forget that all that matters is people. And whether we walk away leaving them better or worse for having met us. I want you to promise me something. If you love someone, you tell them.
Guys, I really love this scene here. I can understand why you guys enjoy Grey's Anatomy. It's all these exciting medical scenes, and then you have inspirational moments like this. And Mark Sloan here kind of reminds me to meet someone and help make their life just a little bit better. You have to show up to work every day, and with my patients, I have the opportunity to help make their lives just a little bit better. So thank you, Dr. Sloan, for the inspiration.
I withhold consent. Before you drug me or sedate me. I give nobody permission to cut off my leg. I want to go home to Callie. She'll know what to do.
So Arizona here says that she withholds consent. And what she's referring to here is informed consent, which is the process of obtaining permission from a patient before any type of medical intervention. And this is a really fundamental right of the patient and so important to good doctoring, where you need to help the patient understand exactly what's being done to them, and you want to explain the risks and benefits of whatever intervention is being performed, and also give the patient an opportunity to ask questions. The other important thing here is that Arizona says that before you drug or sedate me, I withhold consent. And consent should really be obtained when the patient's clear-minded and they're not sedated, because they need to be able to make that decision for themselves with a clear mind.
Yeah, is that fair, right? Does that hurt?
It doesn't hurt. And anything that doesn't hurt feels good. Thanks. Is the infection better or worse?
Don't worry about that right now, okay?
So just a quick recap here is that Arizona had sustained an open femur fracture during the plane crash. And this means that the thigh bone broke and the bone actually poked out through the skin and was exposed to the outside world through the skin. It's a pretty serious injury. And here, Arizona has an external fixator on her femur. An external fixator is pins that are screwed into the bone, which are connected by rods, and that device is stabilizing the bone. And it's external because it's all outside of the skin. Treatment algorithm for an open fracture is number 1, a irrigation and debridement, and then fracture stabilization with an external fixator like this. A debridement is a surgical procedure where dead or infected tissue is removed to promote healing. And that was probably done at some point, and then the external fixator was placed after that. It does appear, though, that her wound is infected still, which is not good for Arizona.
Vancomycin isn't working. Then put me on Clostidine. I'll be stronger.
I understand.
No, you don't. And the longer we wait, the more that my vascularity diminishes, the more the nerves die, and the more the muscle atrophies, and then there's only one option left.
We are so far from that happening.
Do something, Kelly. Promise. Promise me you won't let them take my leg.
Don't promise. No.
I promise.
Arizona here says that the vancomycin is not working. And vancomycin is a medication that is used to treat infections, and she's asking for a stronger antibiotic at this point. So Arizona here states that her vascularity is getting diminished and the muscles atrophying and the nerves are dying, and that's what's going to lead to an amputation. What she's saying here is not 100% accurate, because the vascularity is not necessarily going to be affected by the infection. If a blood vessel is intact, that's not going to change. If an infection doesn't clear, then she can actually get another debridement. They can try different antibiotics to try to treat that infection. Doesn't necessarily mean it's absolutely going to lead to an amputation. It just may be a more drawn out process. Her muscles will get atrophied because she's not actually using the muscles and she's not using the leg, but muscle atrophy isn't going to be the reason why she's going to need an amputation. So Callie promising Arizona that she won't amputate her leg is probably not a good move. It's okay to promise things like, I promise I will do everything in my power to take the best care, but it's just not a good idea to promise a patient a cure or a certain outcome you may not be able to guarantee. In medicine, there just is absolutely no guarantees, and every doctor knows that.
There's a real possibility she may lose her leg. You need to help her prepare for that.
No. An intramedullary nailing can save the leg.
Define safe. Her leg will never be the same. A prosthetic can give Arizona a better quality of life than years of rehab and chronic pain. I don't need to tell you this.
So Callie refers to a intramedullary nailing of the femur, and that's an actual procedure where a metal rod is actually nailed down the central canal of the femur to stabilize a fracture. So Owen here is pushing for an amputation and a prosthetic, arguing that that is going to save the patient more pain and more surgeries down the line. And this is an actual debate that happens in orthopedic trauma, where for a mangled extremity, will a patient do better with just an immediate amputation versus limb salvage surgery? And limb salvage surgery may involve multiple procedures, and the patient has to endure a lot more, and at the end, the leg may still be in a lot of pain. And so this debate is actually happening in real life.
It's Arizona, there's a problem.
What?
She's crashing.
Crashing? She's...
Temp's 104, serum lactate is 6. She's in septic shock.
Shut up. Do you have her impressors?
I've got her on pressors, triple antibiotics. I've got her on aggressive IV fluids.
Did you give her supplemental oxygen?
I intubated her. She's crashing.
So Arizona is not doing well. She's in septic shock, which is a condition where widespread infection is causing organ damage and organ failure, as well as dangerously low blood pressures. Alex here says that he put her on pressors, which we talked about before, to try to raise her blood pressure. He also says that he started her on triple antibiotics, which is basically broad spectrum antibiotics or lots of different antibiotics to try to cover for whatever bugs might be causing her infection. He also says he gave her aggressive IV fluids, which is fluids that is pumped in through the IV to try to raise the patient's blood pressure. Arizona's also gotten to the point where her lungs are failing and that she needs to be intubated, where a tube was placed down her airway to support her lungs to help her breathe. So she's really not doing very well.
She's still deteriorating. She's dying.
It's the leg.
It's the leg.
Cut it off.
So unfortunately here, Callie made a promise to Arizona she can't keep. And this is because of this principle of life over limb. And Arizona's life is at risk right now because of that infected leg. That infected leg is the source of her septic shock. It must be amputated so that Arizona can be stabilized.
Life-sustaining care shall be withdrawn if signs of recovery are not seen after a period of
30 days.
Uh-oh, so this is pretty foreboding, but what Dr. Weber is obtaining from Dr. Sloan here is an advance directive. So an advance directive tells your friends, family, and healthcare providers about your wishes at the end of your life. It really helps to prevent any confusion or conflict, and that's what Dr. Sloan is doing here.
You were right to go. You're probably escaping disaster.
Will you take her, please?
Guys, you guys did it to me again. You guys made me watch another episode where they kill off another character. And it's so sad. He has a toddler daughter. She's in the room and it's tragic. And I feel your pain. Some of you hardcore Grey's Anatomy fans have been very sad about these episodes and I feel your pain. Now let's get down to the scores for this episode. So let's talk about the realism score and the entertainment score. In terms of realism, I think this episode actually did a good job covering a wide variety of orthopedic topics, trauma topics, and for the most part, things were pretty accurate. I didn't see anything for their treatments that was totally out of the normal. And so for realism, I'm going to give this episode a 8 out of 10. In terms of entertainment, I gotta tell you, this one didn't keep me on the edge of the seat like the plane crash episode or that episode where Dr. Weber was trying to hunt down who made the error. That was a pretty intense episode too, but it was still pretty entertaining. I'm gonna give it a 8 out of 10. Alright guys, if you learned something from this episode, please smash that like button down below. If you're new, please hit the subscribe button. Make sure you hit the bell notification so you don't miss my next doctor reaction video. Remember, I read every single one of your comments and I'm doing this episode because you guys asked me to do it. And right now, Grey's Anatomy is a crowd favorite, but I've also gotten requests for ER, Scrubs, The Resident, also House MD. So I'm considering all of those and they're all on my to-do list. Thank you guys so much for watching and I'll see you on the next video.